If you're experiencing joint pain in perimenopause and you're not exactly sure the cause, then I would suggest that you address it following these steps.
Introducing the Perimenopause podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimenopause podcast.
Hey, this is Doc Yates. Welcome to Perimenopause, brought to you by perimenopause.com. And today I want to discuss the different causes of joint pain that could occur during perimenopause, the different steps into how to address that, so that way you don't have to do everything at the same time. And there's a little bit of a sequential order, a way to identify the different causes and the best strategies. So, let's just actually for today, we're just going to jump right into it. There is no additional word from our sponsors. There is no extra stories I want to tell. I want to get you to solutions. So, because it's perimenopause, if you had not had this joint pain before, it's a more recent joint pain and it's not because of an injury, and it's only started recently because of perimenopause, get your hormones balanced. Get your hormones balanced. That when progesterone changes, you'll see that increase in muscle tension, and you'll especially see if the pain is around like some of the larger joints and there's a lot of muscle tension that's forming around it. Make sure we get that progesterone checked out and balanced. The second thing that you need to consider, what joints are we talking about? Is it only weight-bearing joints, or is it non-weight-bearing joints as well? Or is it both? So if it's both non-weight-bearing and weight-bearing, beyond balancing the hormones, the next thing you'd want to address is any causes of inflammation. The number one thing being diet. So you'd want to focus on an anti-inflammatory diet for a short period of time till you can see how much the pain and stiffness reduce, and then you introduce some of those foods back one at a time to see which one triggers it. This is a very, very common problem, and a little bit of a heads up, chances are it's going to be sugar. Next, likely, maybe one of the grains like wheat or corn. Those are the most common ones. After that, it's more obscure things like peppers. But you can do a full elimination diet. Generally, you will see the results within a 4 to 6 week period. At that point, you can start reintroducing. And I've got more information on that, so I'd be happy to dive into that. So we've got the hormones balanced out. Now, if it's a weight-bearing joint, it's not systemic, but it's just the weight-bearing joints. If you have gained quite a bit of weight in perimenopause, balancing the hormones and then doing the work to get the weight off. And then that takes us into point number 4, which is exercise, stretching, and we'll tie in some magnesium, because all of these things have to do with muscle tension. If it's a weight-bearing joint, get some of the extra weight off, but while you're doing that with the exercise, we're going to use low-impact exercise. You need to increase movement. This will reduce joint pain. Low impact to reduce joint pain. If walking is too much, then you can try cycling with low weights. If that's too much, you can use something Pilates, something where you're not even pushing off through the legs when you're weight bearing that much. Stretching is a must, especially if you're dealing with any knee or hip issues. There will definitely be tension through the hips, tension through the hip flexors, quads, and calves that will need to be released. And that's why the magnesium comes in. Magnesium doesn't really have much of an anti-inflammatory effect, but it does have a great effect for reducing muscle tension. And when you reduce muscle tension, you reduce the amount of tension within the joint itself, reduce that compression, take some of the strain off the joint. Number 5, this is where we start getting into getting other people to help for you. This is alignment work. So now we're dealing with, once you've got any inflammation addressed, you've got the hormones addressed. Just because you address the inflammation and address the hormones doesn't mean if things were so tight and they pull out of alignment, it doesn't mean they're just going to automatically pop themselves right back into alignment. So if there's still some issues, getting the alignment done, this would be something I'm a big fan of osteopath when it comes to alignment work. I do acupuncture, and I use a lot of hands-on therapy for my clients. You can use massage therapy, a really good RMT, chiropractic. Any of these things that can help with alignment at this point would then be indicated. Sometimes when you jump into that too early, and if it hasn't addressed any of the hormone issues or you haven't addressed any of the inflammation, you'd know because the effects that you would get from the practitioner for working with alignment would be short-lived. So it's like everything would be pulled back in alignment, but because all the inflammation's still there and because the hormone imbalance is there, the stiffness and the tightness would cause things to pull back out. So if you're getting those treatments done and they're very short-lived effects, chances are there's something underlying that you've missed, and you need to go back and do that first, which is why I have this further down on the list. And then the sixth thing is natural anti-inflammatories. So make sure you pay attention to the first word, natural anti-inflammatories. It doesn't mean you start popping naproxen and T3s like crazy, because this will only lead to other issues. There's so many great natural anti-inflammatories, and yes, they're not as strong as painkillers as those other medications, but when you get these other 5 things addressed first, you generally don't need something as strong as those other pain-killing medications. I always find it's the cases where the doctors jump right to pain-killing medications and they don't address it, and then next thing you know, they need a stronger pain-killing medication and a stronger and more of them, because you haven't addressed the underlying cause, and then the body starts adapting and kind of dependent upon these medications. So some examples, some basic ones: turmeric, ginger, frankincense. These are ones that you can find almost anywhere. Any health food store. They could be teas, they could be capsules. If they're going to be capsules, make sure they're actually like a stronger extract, not just turmeric in a little bit of a capsule. Turmeric works great even when you buy it bulk, like just bulk turmeric from the grocery store, but you have to use more than just 100 milligrams in a capsule. You need to use gram doses of this stuff, so the 1,000 milligram doses. So those are some natural anti-inflammatories. There's a lot more that you can use. Like there's willow bark, there's corydalis, there's birch bark, there's pisidia, works good for the pain. So there's a lot of different herbs that you can use for that. But again, that's further down the list. Make sure you get the other things addressed first. And if you just jump right into these natural anti-inflammatories, these natural painkillers, it'll be harder to assess how much benefit did you actually get from those diet changes. How much benefit did you actually get from the hormone changes and addressing those actual underlying causes? Because if all the benefit was from these natural anti-inflammatories and then you're doing a food reintroduction, it's kind of hard to tell. So that's why I prefer to leave the natural anti-inflammatories till near the end, and then you can just use it to finish things off. So I hope this was helpful. If you're struggling with any joint pain in perimenopause, I hope you can start using some of this information to better yourself and better the health of others. This is Doc Yates, signing off.
Thank you for tuning in to the Perimenopause podcast. Don't forget to hit the subscribe button and visit perimenopause.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenopause podcast.